When would you consider that your cat is a senior cat? There is actually a problem with this because some people would say that it starts around 7 years old, and some others would say a bit late in years, such as 9, 10 to 13 years, which is well where I actually agree. At 7, I think they're not still there, but it all depends on their lifestyle or other conditions that they may have. So uh, I would say that after 7 years old, you should be testing and looking after your cat's health, not considering them actually a senior, but looking after things that may be complicated when they become old. So today we're going to focus on joint disease. What happens to our cat's joints when they are getting old? Because there are a lot of misconceptions about it. We think that just because we get old, these things happen to us. That suddenly, of course, it's normal that my cat sleeps all day. It is normal that they are not jumping as they used to. And let me tell you, I do have a 13-year-old cat, and he plays around like a very young kitten. And this is not because he doesn't have any joint issue. So he still has high youth a spirit. He has like a very young spirit. And this is what it's important. If your cat is experiencing any symptom that may look normal, please go and check it right now. Today we're going to focus on what you should be looking at. My name is Amaya Espíndola, and I'm a holistic vet focused on feline medicine and nutrition. So when we look at joint disease, what problems that we may have, first we need to understand what happens. The most common issues that we see in cats are osteoarthritis. It's a joint degenerative disease. And it's an active process. It's not passive. It's not simply that the joint is it's simply rusting and getting stiff. No, it's when a cartilage it's suffers a damage. What happens is that it creates particles that goes into the capsule, and these capsules activate inflammatory process. So a fire starts. Let's put it this way. So inflammatory process started, enzymes and things, a reactive issue starts becoming. So adding to that, the bone still has to do the exercise that it's doing. So it still has to push and move the joint, and still it's pressing, but it's pressing it on a cartilage that it's damaged. If this is not addressed, then of course pain starts building up, and so on and so on. And so the what does the cat do when this happens? They start grooming less, using weird positions. Maybe they don't jump as much. Maybe they become aggressive if you try to put them in those places. And you can also expect to have some muscle wasting because they are going to compensate their weight using other limbs instead of the ones that are affected. And you would think of, but well, how often this happens? And actually, studies say that it will happen to 60 to 90% of the cats after reaching a certain age, the senior cat. So it is more common that you would like to see it. As I said, osteoarthritis is the most common joint degeneration disease, but there is another, especially associated to larger breeds, such as Maine Coons, would be hip dysplasia, luxation of the patella, and I forgot the other one. Oh, the spinal spondylitis. So I hope now that I'm telling you this, you are not panicking and start looking at over hyper vigilant on your cat, trying to see is it jumping as much as it should? What should I be doing? What do I do now? Because that's a normal reaction for a cat guardian. But let's look into what can we do. You can find online, there is a diagnostic tools for guardians. I'm going to read it because I don't know exactly the name, but it's It is called the FMPI, which is the Feline Musculoskeletal Pain Index. You can find it online normally. So what happens now? Now you're thinking, oh my God, my cat is not playing as it used to. My cat is doing this and that. My cat is about to turn 10 years old. What should I do? Okay. Do not panic. Do not worry. There are things you can do. And of course, there are other things that your cat may acting out, behavioral issues also to look after. So do not panic. And there is a diagnostic tool as a guardian that you can use, and it's very good. You can find the link on the blog section of this video. It's taken from an article, a blog article. Find it. I will put it down below. It's a poor form blog, and you can find one about joint disease, and you'll find several links, helpful links for you to look on how to early detect your cat's issues, especially joint issues. So there is one particularly that it's called the Feline Musculoskeletal Pain Index. It's FMPI, and you can find there what behaviors can be associated to osteoarthritis or any joint issue that could happen. Okay, so they're going to ask you questions on how what is the habits of your cats, how much they play, if they jump, if they climb, and what are they doing. And there are things that are more obvious and some things that aren't. So make sure to go through that if you are suspecting that your cat may have that problem. So then we look at, okay, I might need to take my cat to the vet. And yes, you should. So when you take your cat to the vet, not all cats will behave normally, and it's not always easy to palpate and have a good clinical examination. But if it's possible, your vet will tell you some things that sometimes we overlook, especially the muscle wasting, or if the cat is balancing their body towards the front legs instead of the hind legs, if the problem is on the hind legs, or, we can tell things because we are trained for that, and we can tell if there are some changes that might indicate that this is a problem. Of course, we do have other testings such as X-rays, which are very helpful in this disease. So if we find something, the tools that we have to commonly treat all this are basically anti-inflammatories. But before I get to that, I want to make sure that we get the right diagnosis. First suggestion would be that do not wait until your cat is a senior cat in order to have the first X-ray or treatment or anything. Why I say this is while they're younger, we might detect some things that maybe will tell us that the cat is prone to have a joint disease. If you are a holistic vet, you're not only going to be looking at bones, you're going to be looking at the full metabolism. And there are, for example, things such as the traditional Chinese medicine that also has other indicators that may help you find out what the problem is. Of course, if we tackle things from the start with nutrition, as I'll talk about this later, you're also going to have other tools to prevent this from happening. But if you keep a regular, let's say, if they're too young, maybe not every year would be perfect. But if you can't, just make sure you have regular visits to the vet to have at least a yearly blood work, an X-ray if necessary, or if the cat is overweight, or have a nutritional consult, something that will help you address this problem from the start. But not only that, if when they become senior, we don't have a clinical history from the past, from when this may started, we are kind of going to be guessing things and maybe not tackling the disease or preventing it. So it's very important to have a structure, the one you can allow yourself to have. It doesn't matter. Of course, as I said, every year would be perfect, but if you can't, just make sure to have something to back up and see the progression of any of your cat's problems by having, something to compare it with. and not just the reference levels. Okay? So now let's talk about solutions. What can we do? As I said before, if you can have a nutritional consultation or start feeding right food from the start would be great, because nutrition is one of the best tools you can do to prevent and even, let's say, to cool down that fire that is happening down there in any of the joints. So if we look at nutrition has a huge impact on the metabolism, on inflammatory processes, on immunological processes, and it can also help to repair the body. So if we, there is I would say like a guidance that says that senior cats should be fed a senior diet. And this is a bit conflicting because cats, usually those senior foods contain less protein just to protect the kidneys. But but the problem with senior cats is that there is a normal muscle wasting, because we get old and we need to protect the muscles. And if the cat is not having a good, nice, and activity levels, they are going to have a normal muscle wasting just because they are getting old. And this happens to us as well. We need to protect our muscles. Muscles will hold the structure together. Okay, so if we feed high quality proteins, raw, especially raw, you are going to be given all the nutrients and amino acids that will help the body to, let's say, prevent or moderately repair the damage that is there. At least it's going to help the situation and not make it worse. When we give any sort of ultra processed foods filled with carbohydrates, we are promoting inflammation and also gain weight. So, weight gain. So, the problem is here that if we feed a senior diet, make sure that the protein levels are adequate and not reducing just because I might protect the kidneys. This can be detriment in the future. Instead, try to work on the quality of those proteins. What are proteins are better for my cat, and how do I start giving these foods to them? Because sometimes they can make it difficult for you. But let's talk about some of the nutrients that are included in these diets. One of the most important that becomes very important for cats at this stage is the L-carnitine. L-carnitine is like a shuttle or a transporter that helps all the fat to be available and used into the normal metabolism. This allows that instead of using the muscle to obtain energy, they will use fat. L-carnitine is available in animal tissues, so you don't need to supplement it. Of course you can, but at the same time, again, it is best if it comes from meat directly or animal tissues in general. There are others such as proline or glycine that will also help to cool that and the inflammation that is going around in the joint, and is also available in animal tissues. So again, if you really want to have a good fundamental treatment, nutrition will be the first thing to look at. There is another key ingredient or substance that we can use, which are the omega-3s. Omega-3s can be these fatty acids that will help also aid with inflammation, will reduce inflammation. It works really well with L-carnitine, and it can help reduce all that that war zone that it's there in the joint, that it will help it cool down. If we look at other things that may help, of course, we have supplements, and I'll talk about those because we need to be very careful in which other supplements we use in every case. Another important thing that is related to nutrition is the obesity and the overweight animals. It's not just about carrying more weight. It is also that the fat tissue, it acts as as a hormonal, it releases a hormone called adipokine. And what it does, it's put fire into the fire. So we are not only carrying more weight and more pain for that bone that it's working on a joint that it's actively destroying itself. It's also going to have that adding to that inflammation addressed by this hormone. So it's going to make it even worse. Last but not least, there is another thing involving genes and nutrition, which is the epigenes. When we look at our genetic material, we have some genetic predisposition to certain things. We have genes that may turn on and turn off. But what makes them turn on or turn off? It's the environment, your nutrition, and yeah, basically everything that surrounds you and how you interpret those. So if you have a cat that is also stressed or it's overweight, and also overweight causes stress, it's associated behavior around it. Um, if we have a poor nutrition, all of these things are going to turn on the genes that we don't want that are, you know, predisposing the cat to have actually osteoarthritis or any other related joint disease. If your cat has a good nutrition, good activity levels, good environment, home enrichment, and you take this seriously, you may turn off these genes. And even though a cat is predisposed to have this, it may not be expressed, or at least will silence those things that may make the situation worse. Okay, so it's very important. So, as I said, nutrition is one of the key fundamental therapies that you should be working on before adding any other supplement or anything else. So, moving on into treatments, we need to look at what is available. Both basically, what we do is reduce pain. As conventional vets, that's what we can do. Or maybe there is a surgical procedure to be done, but otherwise, it's going to be reducing pain. And what do we have available is non-steroidal anti-inflammatories, or we have Solensia, which is a monoclonal antibody that will help to reduce the hypersensitivity on the cat. So it's just reducing pain. None of these solutions are actually solutions. They are simply trying to address something that is very painful and most of the time necessary. But of course, none of these medications come without any risk or secondary effects. Actually, nowadays, first of all, we had the issues of using so many anti-inflammatories, and now Solensia, it was like the magical solution for cats. And we used to give it, well, we give it every month, and it's easy and it's just reducing pain. Okay, there is no actual repairing of the tissue. There is nothing going on there, simply making the life of the cat better just by reducing pain. And okay, it may work, but it may not. And maybe you need to go to stronger medications in order to keep reducing pain. So you're just trying to put a blanket over the fire just to, let's push it away. And I don't see it. I don't care. It's okay. It's burning, but I don't see it. So this is very important. We need to address things in a more holistic way. We need to look at, okay, what is causing it? Are there supplements that may help my cat? Do I have to reduce weight in my cat? Physiotherapy might be good. Hydrotherapy would be great if all cats would likes it, but not all of them do. You have acupuncture. You can do things at home. If your floors are slippery, you can make it easier for them to create a better. You can have like a activity center for them, so their muscles are built, or you can create safer structures for them to climb and to keep doing things as a cat, because the lack of activity will hurt the joints even more. So we need that muscle to sustain and hold that structure. And this is important. And you can do things at home. There are therapies that you can apply. So try them. At least do. And if you need to use some anti-inflammatories, of course, most of the time you will. But there are also supplements that will help aid that, and maybe not using or abusing the amount of anti-inflammatories. You can use CBD. There's also really good anti-inflammatories such as curcumin or which is turmeric. You can use boswellia, which is another supplement that could be potentially good. But again, I don't like offering so many supplements because if you don't address nutrition, which is the basic thing, uh, I think it's very individualized, um, and I just don't like giving supplements and hoping that they may be good. It's best if you address every situation, looking at what I can do, what can be done for the cat. Is it anti-inflammatories for a time? Is it using certain supplements? Is improving nutrition? Is improving activity at home? What does my cat actually need? And that is individualized. Okay, and I'll fight for that. So there are other supplements that we are used to using, which are the GAGs, where it's a combination of glucosamine and chondroitin, and these are very common, and you can find them on the market very easily. But it's been proven their results are not quite as expected. It makes us feel good, but not too much to the cat. It doesn't actually. There are substances that help the cartilage. They're part of the blocks of the cartilage, but supplementing the absorption, the availability of those substances may not be good enough. Okay, so they may not work. So instead of using this kind of supplements randomly, we need to focus on, okay, what do we need to do? Do we need to use inflammation? Does my cat approve it? Does it like it? Can I combine things? Can I combine this with a acupuncture or any other physiotherapy? What can I do at home? As I said before, you can prepare the house to make it uh, more effective for your cat in this stage. So there is a full thing to consider, and I want you to start considering it, because we are looking for the magical element, and I'm sorry to say there is no magical element. It's about all the small things that you do every day that will improve your cat's life. And osteoarthritis or any joint disease is not doesn't make any difference than anything else. So please, when you look at your cat's joints, first of all, be observant, be curious, ask around, get your examinations, your clinic examinations, download this diagnostic tool at home, connect with people to see, okay, what can I do to make my cat's life better? And I hope you do. And in any case, you can always reach to me. So thank you for listening so far. I hope you find this helpful. See you next time. Bye.